Welcome back. There is simply no more important topic than what we're about to discuss right now regarding your health and that of everyone in your family, friends, and extended family, neighbors, etc. So joining us now to talk about cardiovascular health is Dr. Badhey.
That's right.
Is that right?
That's right.
From an interventional cardiologist from Texas Health, Hurst Euless Bedford, HEB. So, doctor, thank you for being here.
Thank you for having me on the show.
Yes, and like I said, this is such an important issue. Tell us, first of all, how serious this condition is and how many lives are touched and how many people we lose based on cardiovascular disease.
So I think cardiovascular disease is a big issue in today's healthcare environment. It's the #1 killer. It kills more than the next 7 causes combined. There's about 900,000 deaths a year from cardiovascular disease. So if you do the math, it's about 1 in every 37 seconds. That's quite a lot. That's quite a lot.
Wow.
And
you had a number that shocked all of us here about the number of people that die from heart disease compared to breast cancer, for example.
That's right. You know, I think it's an awareness issue. And February is the month of Women and Heart Disease. You know, it's a special month, and the American Heart Association does a great job trying to raise awareness. I think it's an awareness issue that is underestimated grossly. You know, there was a survey done asking women out there what is the most impending cause of death for women, and about 75% of them answered it being breast cancer.
Right.
And the reality of the matter is cardiovascular disease kills more people than the next 7 causes combined. So to put that in perspective, 1 in every 40 women will die from breast cancer, but about 1 in every 2 will die from a cardiovascular death.
Wow. 1 in every 2.
That
Absolutely
is
right.
remarkable. And speaking of women, some of the conditions of cardiovascular problems or lack of cardiovascular health manifest themselves differently between men and women.
Yes.
Is that true?
Absolutely true. And I think, you know, we've all grown up watching the ER show where you see this patient walk in the ER clutching their chest, you know, gasping for air, and that's the typical heart attack. But it's not necessarily true in women. And I think a lot of women can present with jaw pain, shoulder pain. Some I've seen present with indigestion, and they ignore it. Wow. And as you ignore it, they present to the ER much later, and the damage has already been done significantly. So
Did you say jaw pain sometimes?
That is absolutely right.
Really? I haven't heard that before.
Yes, jaw pain and shoulder pain is very, very common.
Now, as we're outlining all of the potential problems, folks are probably asking themselves, okay, what do I do to avoid dying from this disease? Right. What are some of the precautionary measures that they can take, either diet or with lifestyle? And then, you know, what do they have to do with their docs?
And I think it's that's great, because cardiovascular disease is largely preventable, and that's very, very important. If you can take home one point today, is that cardiovascular disease is largely preventable. It's all about modifying your risk factors: cholesterol, diet, exercise, diabetes, smoking. These can all be modified within your limits. Genetics do play a big role. Genetics are hard to modify, but if you can modify your risk factors, talk to your doctor about
prevention. Who's more at risk genetically? Who's more at risk?
Genetically, it depends. If you have a primary male member who's died of a heart attack less than 55, or a primary female member who's died of a heart attack less than 65, that does place you at risk.
Has the decrease in smoking made a big difference in this country?
It definitely has. I mean, the effects are now being seen as the incidence of cardiac death is going down finally. But quitting smoking, it is a known fact that if you smoke, you're 10 times more likely to die of a heart attack than if you're not smoking.
10 times. And why is there such a disparity between this country and other countries in terms of our cardiovascular disease?
I think partially it's diet. You know, this country is very quite dependent on fast food to some extent, and I think fast food is not good for you. I think diet, we don't pay enough attention to exercise as much as we should do, and I think those are 2 of the biggest factors why this country needs to sort of has a higher incidence of cardiovascular disease in other places.
Which country's getting it right as far as diet is concerned? I know we're experimenting all the time here in America with the Mediterranean diet or certain types of diets. Who gets it right?
The Mediterranean diet. The Mediterranean diet is actually shown one of the few diets to reduce your risk of cardiovascular disease. So the Mediterranean diet is absolutely a great diet.
Fish, olive oil, nuts.
Exactly.
And fresh veggies.
Perfect.
Right?
That's absolutely right.
We've heard it before, we just don't do it.
Right.
These small things add up, and it makes a big difference.
Yeah, and that's an important point. You don't have to make dramatic changes. You can make very small, incremental changes over a long time. It will make a big difference.
Absolutely.
Right?
Absolutely.
Okay. And go see the doctor. When should you have some kind of a more focused cardiovascular exam? At what age?
So there's no strong recommendation as to a certain age. So say, like, oh, if I'm going to hit 55, I got to go get a stress test. There's no strong recommendation condition like that, it's a combination of your risk factors. So talk to your primary care doctor. Look at your risk factors. There are various risk calculators out there. There's a myheartage.com, which will calculate your heart age for you. There's different resources on the American Heart Association that can calculate your risk for you, and that will tell you at what point you need to see, get further testing done.
And something else that we just have to reiterate here is that heart disease is much more a threat than
breast cancer.
So many breast cancer and all the things that we hear more about.
I mean, again, a take-home point: cardiovascular disease is the #1 killer. Kills more people than the next 7 causes combined.
Wow, that's a great reminder. Dr. Badhey, thank you for coming
Thank you so much for having me on the show.
Texas Health HEB, thank you for being here.
Thank you.
Coming up next on the Texas Daily, it's probably not doctor approved. Don't listen to this. Not doctor approved, but we're going to take a look at an item on the new Taco Bell. Now, wait a minute. We can't just talk about heart health and then talk about Taco Bell. Come on. All right, we're going to do it. We'll be right back after this. How did that